Next up, family, we have a very intelligent young lady by the name of Dr. Maddie Naughton, who's going to give a really good presentation about overall health and wellness for all ages. So stay tuned and listen to some really good tips that's good for your overall body and physical health.
Really excited to be speaking today. This is all things that I'm extremely passionate about. I was really excited to hear Toya talk about mental health because she's totally right. The funny part about that is while I was making this presentation and going through it, I was thinking the exact same thing of, oh my gosh, when they tell you you have to put your oxygen mask on first. And one of the bullet points you'll see later in this PowerPoint is me referencing how you have to be able to take care of yourself before you can take care of others. So that kind of ties us in together as we start off today. I'm going to be talking a little bit about being strong for life. This is wellness at every age, right? We are trying to be well from a child all the way on throughout the lifespan. So Joy did a great job introducing me, but like I said, my name is Maddie Naughton. I'm a doctor of physical therapy, and my undergrad degree is in exercise science, so it works out really well for something like this. A majority of my time I treat people that have pelvic health concerns, so we're thinking like bowel and bladder function actually, and then I also see people that have pain throughout the body too. And then I see a little bit of cancer rehabilitation, so people that have had prostate cancer, any sort of gynecological cancer, and then breast cancer. So a nice wide variety, but physical therapy can see quite a few things. And then, like I said, my passion point is in education, educating communities, educating other health fields on what physical therapy can do for you and how you can get set up with physical therapy. So some of the things we're going to discuss today are right on line with what we heard in our last presentation. I'm just going to be tying this a little bit more to physical health. So we're going to walk through the importance of physical health throughout the lifespan and how we relate that to movement. We'll then learn a little bit more about bone and muscle health and what you all can do to support that. We'll also review some preventative health screenings throughout life stages. I think that's something that is really important and sometimes often forgotten about. So what are those key timeframes of when you should be going and seeing a health provider to make sure that all those things are on the money, right? We want to make sure that we're staying healthy, that we are being preventative and not just reactive. And then finally, we're going to talk through some practical steps for each life phase so that each of you can go home with something and a place to start in terms of exercise and being active throughout your day. So first, we're going to discuss wellness across the lifespan. I'm going to take us through multiple different life phases. I have it split up into like early adulthood, mid-adulthood, and then late adulthood. Okay, so we'll start here with young adulthood. So whether you are a young adult or not, I want you to either think back to that time frame or consider where you're at currently. The focus between ages 20 to about 39 or so, again, these are all just ranges, is building and maintaining a strong foundation. So ages 20 to 39 is when you are building the bones and the muscle strength that are going to take you throughout your entire life. Does that mean if you didn't do it then that you can't do it now? Definitely not, and we're going to talk about how to do that. But this is when we can make the biggest amount of change on bone and muscle health. When thinking about bone health, our peak bone mass occurs actually at our early 30s. So that means that we are peaking at early 30s and you are declining down into your late 30s even. So you're not just losing bone health or bone density in your 60s, 70s, 80s like we might be thinking. This happens as early as the mid-30s. Wow. Resistance training and adequate calcium and vitamin D are how we're going to counteract that in our daily life, okay? So these are key. You cannot be active physically without having the nutrition to support that. So I'm glad that you all are going to be kind of seeing that as you're eating brunch here today. Strength training 2+ days a week is key to doing this. We're starting that early. We see that now even into middle school, high school, and that is really important for building bone and muscle health. We're also going to make sure we're emphasizing form, variety, progressive overload. We want to be doing a variety of things, and I'm going to talk you through what those things look like in just a bit. Aerobic activity, so I'm talking about walking, running, biking, swimming. Doesn't just have to be one capacity or one type of form, but we want at least 150 minutes of this a week. And a lot of times I talk to people and I'm like, you should be doing 5 30-minute workouts throughout the day, throughout the week. That would be a lot. Please don't do 5 30-minute workouts throughout the day. You're going to come back and be like, that Maddie girl is really confused. But throughout the week, we want to hit 5 30-minute dedicated aerobic exercises. So people are saying, okay, well, I probably walk 30 minutes throughout the day. I have no doubt, but this is something where you are walking 30 minutes and you are saying, I am starting now, I am walking for a continuous 30 minutes, and that is my exercise. We know you're going up and down the stairs, moving throughout your life, but this should be something that you are sitting down and being like, I am carving out this time for exercise. Again, that can be brisk walking, cycling, swimming. It can look like a lot of different things. If you're going to the gym, all of those cardio machines, the elliptical, things like that. Posture and core strength are also really important, and we should be starting this in young adulthood, especially if we're sitting at a desk a lot of the day, if we have more sedentary jobs. We want to make sure that we're thinking about how are we sitting? How are we standing? I get the question all the time, okay, what's the best way that I need to sit? Well, unfortunately, there's no answer for that. The best way is to move. I don't want you in a sustained posture for more than 30 minutes. So if you're sitting at a desk and it's been 30 minutes, stand up, move around, sit back down. There's not a perfect posture. Your body is meant to be dynamic. It wants to move. It wants to be fluid. And then finally, recovery. You can't do all these things if you're exhausted. This means both physically and mentally. We need to be able to take care of our mental well-being before these things can often fit in. Here, these are some of those health screenings that we're starting as early as age 20 and 21. Again, these are things and markers that we should be looking at with our primary care providers. We're making sure that females 21 through 65 are getting regular pap smears and HPV testing. This is recommended for everybody. We should start by getting blood pressure checks every year, cortisol, cholesterol readings. So you should be getting your blood drawn once a year, even when you're 20 years old, so that we can create the foundation. We're starting early here. Regular dental, vision, and mental health assessments are key. So I love that Toya reference having a high schooler see at least a counselor 3 times. That is incredible. I love that thought. I think they should also be talking to someone about their physical health as well, because we want to set them up for success. So think about those people in your life that you can talk to and really instill this thought process in. So now we're moving on a little bit more to midlife, okay? So this is age 40 to 64-ish, right? This focus is going to be prevention, strength preservation, and cardiovascular health. We've already talked about how that peak bone mass and muscle mass is occurring in the early 30s. So in this stage, we are actually maintaining all of those things as best as we can. Bone and muscle maintenance, we want to continue resistance training. My biggest concern is when people come to me and they're like, I am too old to lift weights. Absolutely not. You are never too old to lift weights, and I encourage you to continue to do that, and I'm going to walk you through how you're going to do that, because I want you to be able to, at 75, 85, 95, get up and off the floor. You don't know if you can do that unless you try, right? Again, that aerobic conditioning, you're still working out 150 minutes a week of that cardiovascular training. That is the same parameter at all ages. We want to mix endurance and interval training for heart health. We don't just want it to be a high intensity. I love my runners. A lot of the runners, they just are like, I'm going to run all week. That's amazing. I love that. What are you going to do to counteract that in your heart? We want your heart rate to be slow at some points, and we want it to be fast at some points, and we want to make sure it can do both of those things. In terms of flexibility and balance, this is where we really start to see people getting up and being like, I feel stiff today, right? They're like, I either slept wrong, something happened. How are we going to counteract that, right? So ages 40 to 65 is when we really need to start to embed a mobility program. So regular flexibility training, even just gentle stretching means a lot. That might mean that when you wake up, you spend a little bit of time rolling side to side. You spend a little bit of time rotating your hips in and out just to help you prime your muscles for the day. And then we're thinking about things like yoga. Pilates is a big one right now. A lot of people are doing mat Pilates, reformer Pilates. These are great for strength, stability, and mobility. And then, like I said, a regular mobility routine can be key. This doesn't have to be anything specific, right? You can go on YouTube and find a mobility routine for every age. I highly recommend trying things like that. Like I said, and we've alluded to, I want this to be safe and recommended by your doctor. Most primary care doctors are going to be thrilled that you're doing some level of activity, but we want to make sure that your body is ready for that. And then finally, stress management. We talked about this a lot in our last presentation, and this comes together really well here. Chronic stress affects our hormones, our sleep, and our blood pressure. We don't want to be running around when our blood pressure is already elevated because we're experiencing some stress and anxiety. So we need to be able to regulate where we're at in terms of our heart rate, our blood pressure, before we go and elevate it even more with exercise. And then the other part of this is hormonally, a lot of changes are happening between 40 and 65. So this is with females and males. I know a lot of people think about females going through some changes hormonally with things like menopause, but this happens with males too. We see a lot of changes in testosterone, and in females we see a lot of changes in estrogen and progesterone. So we need to be really conscious of how we're maintaining our strength and health so that we can combat those steep declines as we age, okay? It's harder for males to build strength into age, and we're going to talk about that too, but it's just as hard for females. So both of these people need to be focusing on that. Our next slide here talks a little bit more about the health screenings. As we pick up into midlife, this is when the health screenings become more and more important. If you have not had these things, I encourage you all to go home and find how you are going to do it. Things like mammograms every 1 to 2 years starting at age 40 if you're a female. Colorectal cancer screening at early as age 45. So that used to be 50. They've actually put that a little bit earlier now to 45 because they are seeing higher incidences in younger people. And as somebody who treats people who are undergoing cancer treatment, I am really passionate about prevention. When we find these things early, the prognosis is so much better. So I want you all to know that you can reach out and get these things, and they are covered. Your insurance wants you to seek prevention because they don't want to pay for it later, frankly. PSA testing, so this is that prostate stimulating androgen hormone. So males are at risk of prostate cancer. It's a very slow growing process. So if you catch it early, it's really easy to mitigate. We want to start testing those levels at age 50. This should be in a general blood panel with your primary care provider. But this is really important because when caught, it can be, just a little blip in your life. But if you don't see the test until 20 years later, it can become much more of a headache. And then diabetes and lipid panels are also going on at least every 3 years, making sure that your A1C looks good. And finally, a skin check annually. So if you didn't start that in ages 20 to 39, we really need to do it ages 40 to 65. Anybody who's had sun exposure needs to go. All of you have been outside in some time of your life, right? So we need to get our skin checked. I think it's something that people forget about because you live in your own body every day, so you don't see those small changes. We're going to go into talking a little bit more now about older adulthood. So what does this look like at ages 65 and up? This focus is now more so on independence, balance, vitality. How are you going to live your longest, happiest, healthiest life, okay? So bone health becomes even bigger. We've all heard, oh my gosh, my grandma, she fell, she broke her hip. It happens, it is scary. How are we going to prevent that, right? So bone health is key. Maintaining weight-bearing and resistance exercises. These are my people that I want you to pick up the weights. I want you to do standing exercises. I want you to do a wall push-up because I know that you can bear weight through those arms. This is how we're going to slow bone loss. Everybody's going to experience bone loss. That's just how it is. But this is how we are going to slow it as best as we can and reduce our fracture risk. A fracture as we age gets even more, it gets scary as we age, frankly. So we want to catch that early. Strength and balance training. Again, weight training is appropriate at every age. We want to keep seeing this. And introducing things like Tai Chi and yoga for balance are incredible. They have amazing chair yoga programs on YouTube. My grandma, who is 85 years old, and she is so sweet, she used to teach chair yoga at the community center, and it was like the highlight of her day. They have these programs, and they're amazing because they walk you through exactly what you have to do. You have a community based around you. I know I much prefer to exercise when I have other people around me. I need that little external motivation. And then again, our aerobic activity, I'm pounding this into you all because I still want you to have 150 minutes of moderate intensity exercise a week, okay? Brisk walking counts. Anything of that nature is more than appropriate to fill this category. You may even enjoy things like water aerobics, especially if you're having some form of arthritis. That can be a little bit more gentle on the joints. And then that cycling can also be appropriate, something like a recumbent bike. And fall prevention. So here's the stage where we're starting to think, how can we set up our home for success? We're making sure that we don't have little rings in our carpets, right? They're not bunched up so that we can trip over them. We're being conscious of where cords are. So I'm constantly looking at where I'm keeping this cord while I'm holding a microphone, but you may be vacuuming. We want to be conscious of where that is. And then we're looking at balance training. Are you still able to stand on both feet when they're together? Can you stand on one foot? What happens when you close your eyes? What happens when you step up onto a curb? And if these things are hard, we want you to seek treatment earlier, and that's where physical therapy can come in. And then finally, vision assessments. We want to make sure that we can still see. If you can't see, you don't know what you're going to fall on, right? To continue to talk a little bit about some of those health measures, so you can go on to the next slide, that we want to be weary of is now into older adulthood. We're thinking about things like a DEXA scan. So those scans, and there's a little bit of an image of what that looks like in cartoon form, tells us what our bone density is at big markers. So they look at our hips, they look at our shoulders, they look at our back, and they are reading what the bone density at each of those areas is. And then they have cutoff scores. So you may have heard someone say, oh, I have osteopenia, or I have osteoporosis. Osteopenia is that precursor to osteoporosis. So these bone scans are what tells us if that is something that we need to be weary of. And this should be occurring for any woman over the age of 65 and any male over the age of 70, okay? Really, really important. We're still doing our mammograms, our colonoscopies. Nobody said either of those were fun, but they are so, so, so necessary. We're doing more frequent blood pressure and glucose monitoring. We are looking at our cholesterol and maintaining that as best as we can. And then finally, there's a higher importance of the flu, pneumonia, shingles, and tetanus vaccines. So just like a young child is really susceptible to illness, right, because their immune system is still growing, it's like a bell curve. Your immune system's best in midlife, and then it starts to go down again as we age. So it is really important that you are starting to think again about, okay, when was the last time I had a tetanus shot? I need those every 10 years. Ooh, maybe it's been 50, right? Have I had a flu shot? Am I going to be in a place where I might be more susceptible to catching this? And if you're around an older adult in your life, what can you do to protect them? Okay. So what are those key stats? These are big numbers and they are important. So in the United States, about 10 million Americans who are 50 plus have osteoporosis. That is a ton of people that have weak bones, right? An additional 44 million are diagnosed with low bone density. That is so many people, right? There's people in this room, I'm sure, who have osteoporosis and don't know it because it's something that doesn't get evaluated. It's scary. It really is. 1 in 2 women will suffer an osteoporosis-related fracture during their lifetime. So that's 50% of people, of women. Among men in their lifetime, their risk is about 1 in 8. Just because of how their hormones and their genetic makeup is, they experience less fractures. Doesn't mean it can't happen, and it doesn't mean they can't have osteoporosis. Here is the big one that I don't think is talked about as much. We hear osteoporosis as a buzzword, but we also have a natural process of muscle loss called sarcopenia. So we have sarcomeres in our muscles. That is what helps contract our muscle, okay? Those start to begin to deteriorate, again, as early as age 30. So muscle mass begins declining 3 to 5% per decade after 30 if you do not take any measures to counteract it, okay? So we have to be really, really intentional about how we are moving our body, what resistance training we are doing. Are we lifting weights to counteract that muscle loss? It doesn't have to happen, okay? As we lose muscle, our resting metabolism also slows. So weight gain becomes easier, we increase our risk for diabetes and heart disease. So we start to see that muscle mass is changing into fatty tissue. So we may be the same weight for many, many years, but actually the percentage of muscle to bone to fat has changed. The way that you can look at this is actually there are like vitamin shops, there's quite a few of them around here. First Form shops, any of the shops that sell like creatine or protein powders, all of those places have what we call an in-body scan. You can do an in-body scan at any of those shops for really inexpensive, sometimes free because they're trying to sell you a product, but still. And they will give you a rundown of how much muscle and fat is in each one of your limbs and in your trunk, which is just your belly region. So that can help you get a baseline of where are you at now and where can we go from here. And they do a really good job deciphering that data for you, but it's really accessible just at all the supplement stores, okay? And then muscle strength also declines 12 to 15% per decade after age 50, okay? So strength and muscle bulk are different. So we learn that 3 to 5% of muscle bulk starts to decline, but strength declines even quicker. So you may still have the bulk, but the strength isn't there, right? So that can be really scary. And that, again, is right after age 50. So we start to lose bulk in our 30s, and then we lose even more strength into our 50s. And just because the muscle mass is present, it doesn't mean the strength is still there, okay? So even if you go and you get your scan and they say you have 50, 60 pounds of muscle tissue, is that muscle tissue working is the next question, right? All right. So what can you do? You can still reverse this trend. Aging is inevitable, right? Aging is inevitable. Unfortunately, I'm not a miracle worker. I cannot bring you back to 10 years ago. But we can reverse that slow loss, okay? So we can make it so that this trend does not keep coming, that you are not losing 12 to 15% of strength each decade, but rather maybe 1 to 2%. Think about the big difference that'll make when you're 80, okay? So this next slide is going to walk us through a little bit of how we are going to do this. So I've talked at large about aerobic conditioning, 150 minutes a week of walking or cycling, but strength training should be about 2 to 3 times a week, and this needs to include all major muscle groups. So I have a handout somewhere maybe floating around if you all have or haven't gotten it, and that is in regards to some of those key stats, perfect, and on the back of that, there is a sample exercise chart. It takes you through 2 different days, and it talks about all areas of the body that you should be hitting throughout the week. I think sometimes it can be helpful because it's like, okay, now I have to work out. They told me I need to strength train. What does that mean, and how am I going to do it right? So much easier said than done. So we want to, make sure we're hitting those muscle groups, and I'm going to go through some exercises later here. But then we also need the nutrition to support those muscles. So you guys are having a very nutritious meal right now, which is supporting this goal already. We're wanting to get about 1 to 1.2 grams of protein per kilogram of weight, okay? So this is not in pounds, so this is not if you're 150 pounds, you need 150 grams of protein. It'll end up being a little bit less than that. But you can easily go online and see what your body weight is converted to kilograms, and then that's how much protein you should be having per day about, okay? And then, again, we're going to use it or lose it. So if you do not keep exercising, you don't keep strength training, you don't keep walking, you aren't going to be able to do it. I referenced earlier, if you don't know that you can get on and off the floor until you do it, and if you don't do it, you may not be able to. I was talking to my grandpa yesterday on the phone, and this is my grandpa and my grandma. My grandma's the one teaching chair yoga, and my grandpa is also a yoga instructor and very active. And he is a hoot. And I talked to him yesterday, and I said, Grandpa, when was the last time you got off the floor? He goes, I don't know, why? And I'm like, well, what happens if you end up on the floor? And he's like, well, why would I end up on the floor? And I was like, you know what, Grandpa, I hope you don't, because I don't want you on the floor. But you live alone. So what happens if you slip or you trip over your little dog who is adorable, that you love dearly, and then you have to get up? And he's like, that's my homework for tomorrow. I'm going to see if I can get up off the floor. I'm like, okay, well, you make sure that you're close to the couch in case that you need a little push. But that's something you really don't know. And a lot of my patients that I see, I always ask them, and I always have them do it. One of my tests, I don't tell them I'm testing them. I tell them, all right, we're going to do, an exercise on the ground, and I watch them get on the ground, and then I'm like, all right, we can get on up to the next thing, and I watch them get up, and I see how quick and easy that was for them, and if it wasn't, we make that a point of education of, hey, that was really tough. When was the last time we practiced that at home? How can we begin to do that, right? So really, really important things that you can consider here. On this next slide, these are some of the major muscle groups that we're hitting. So on the back of that sheet, like I said, there's a little bit of a chart, and then it has room to write in your own exercises. When I'm thinking about resistance training, I'm thinking about compound lifts. A lot of times people see these pictures and they're like, oh, I'm definitely not doing that. If you think I'm going to the gym and getting a barbell, that's hilarious. I feel the same way. I'm not going to lie. I don't use a barbell to do these exercises. But you should be including some form of a squat, some form of a deadlift, which is just hinging at your hips. So if we're thinking a squat is bending at our knees, a hip hinge is bending at our hips, okay? Those are two imperative tasks to daily life, okay? You get in and off the chair, and I know you get on and off the toilet, so I know you do a squat, and you, I'm confident on that as someone who treats people for bowel and bladder problems. Yeah, you get on and off the toilet, I hope. I've only had one person that told me they don't use the toilet. I still haven't figured out how that works. Yeah. So I hope that's not any of you. And then a lot of you all are going to hip hinge to go and grab stuff out of the dishwasher, pick something off the ground, all of those things. So those are imperative. Now, I don't do a pull-up. I can't do a pull-up. I mean, let's look at me here. I'm not doing a pull-up. But the importance is that you're able to pull something. So I'm talking about going to the gym or grabbing a resistance band and pulling downwards. We want to hit those back muscles by pulling down. It doesn't have to look like that. Bench pressing, so something that we're using to activate our chest. It doesn't have to be with a barbell. It might be a push-up, right? It might be a wall push-up. That can be really accessible to any age, at any stage of life. This might be like pushing a sled. Ooh, that was a hard one for me to get out today. Overhead press, practicing lifting things and putting them in your cabinet. Grabbing, your heaviest bowl and trying to get it in your cabinet, seeing what you can do there. Dips, again, this is working those triceps, so I'm not expecting you all to go home and do a dip or get a little pull-up bar with a little dip bar on it, but what you can do is practice activating those triceps. We're thinking about making a little bent over row or, again, something that you're pushing. So really, when I'm talking about my patients, I'm thinking, do they have an exercise that they are pushing something? Do they have an exercise that they are pulling something? And do they have an exercise using their legs, okay? Those are the three major things, and the back of that exercise sheet takes you through it. Now, this may be any of these exercises on more the left side, so the squats, the hip hinging we talked about, the pressing, can all be done with dumbbells. If you have access to dumbbells, they can all be done holding a water bottle in each hand. You can push a water bottle overhead as many times as you want. One thing that I did not write up here that I want you all to make note of is when you are building strength, we need to be getting to failure. So that means that you are pushing overhead your water bottle until you can't push it up again. That's how we build muscle strength. It's hard, okay, but you need to find something heavy enough that it is difficult, okay? We want things to be challenging for you. Same thing with the squats. We're doing a number of repetitions that you are feeling fatigued. I'm not saying go home, do so many squats that you can't stand up tomorrow, because I want you all to make it back here tomorrow and be able to do what you want to do, right? So don't do that, but yeah, don't do too many. Otherwise, they're gonna come back and be like, oh, that Maddie girl, she's got something. All right, the next slide here is how are we going to do this in terms of faith and community? So how can we use the group that we already have? I love the Google Classroom idea of supporting other people. I scanned that code and saw it, and I love that. This is a great way to find somebody who's an accountability buddy. Because again, it is so much easier to be like, I want to strength train 2 days a week. They told me that's what I need to do to be healthy, and I'm going to do 150 minutes of, walking a week. Well, it's way more fun if you can tell other people you did it, right? Nothing's better than, going to work and be like, yeah, I worked out this morning, right? And people are like, you worked out this morning? You're like, yeah, I did. Are you going to work out with me? A little bit of healthy competition is good, right? Incorporating prayer, gratitude, stress reduction is part of that wellness piece, and Toya gave a lot of tangible things that you can do with that. That first bullet point actually takes us back to that whole idea of the mask on the airplane was you have to take care of yourself before you can then have others, help others as well. And then finding that community support, we talked about this, walking groups, group fitness classes. So the YMCA has a nationwide program called Silver Sneakers. Yeah. If you're not familiar with that, it is incredible. It's great, right?
And it's free.
It's free, exactly. A lot of times Medicare covers it. We'll cover a gym membership for you. So if you have health insurance, see if they'll cover you a gym membership, because a lot of times they will. Yeah, so really important stuff, but Silver Sneakers has a lot of really accessible weight training classes. They are geared towards older adults, but anybody is open to coming. It is beginner form of exercise. It also is a great place to meet other people that are like-minded. And then even something like a cooking class or finding, inviting some people over and talking about what you all learned today, making food together and finding a community that way. Next slide here. Here are some more of those resources. So again, the Community YMCA, I love that. That access point can be huge. Any form of group fitness can be nice. So even creating a form, a group within yourselves, and even using that Google Classroom, you might be able to find some other things or other people that want to exercise with you. I'm affiliated with SSM Health Physical Therapy because I work for them, but I'm speaking just on behalf of myself today. But SSM Health Physical Therapy is a great resource. They have clinics all around both the Missouri side and the Illinois side. So I work in Illinois, but I have even more counterparts that work in Missouri. We have programs called OrthoVive, which are actually helping people that have any sort of joint pain get back to exercise. So if that sounds like you. You can see a PT before you go to your primary care doctor. We all have doctorates of physical therapy now. You can see a PT before you see them. So come on down, give us a call, let us know that you're in need of some more support. I personally represent Corvia, which is our pelvic health program. So a lot of people don't know that physical therapists can also treat bowel, bladder, and sexual function concerns. So that is what I spend a lot of my practice doing, as well as just any issues of the pelvis in and of itself. But if that sounds like you too, and you're like, you know what, I don't want to go exercise because the last time I did a speed walk, I leaked a little bit of urine, so maybe I'm not going to do that. Come visit with me, right? Every time I do a jumping jack, I'm like, ooh, that doesn't feel so good. That's normal. It's not normal, but it's normalized. But it doesn't have to be you. So there are people you can see for that if you feel like that is your limitation to returning to activity. And then that worksheet and handout, the front side has some of those key facts we talked about. That back side is just a beginning start of what a workout program could look like. That's built to be a 2-day program. And it allows you to write in the exercises you do, the number of repetitions, and the weight. The reason that that's important to keep track of is, ideally, we don't want to be lifting the same 10-pound weights for years and years and years. We're trying to get stronger, right? So we want to keep track of, okay, I used to use 10-pound weights to push overhead, but now I can lift 11 or 12 for the same amount of repetitions. So that helps you track your progress. It's also a really meaningful way to seek goal setting, right? So Toya talked about realistic goal setting. That's a great way to start with a realistic goal. And then finally, the American Heart Association website has a lot of really great information. So if you look up American Heart Association, they have an incredible walking program that is already designed for a beginner who is like, you know what, I just want to get back to some form of activity. It walks you through exactly how to do that. So that may be a good resource if you're maybe contemplating strength training at the moment, but you're thinking, yeah, I could do a walking program. It starts as little as 3 minutes of walking in a row. And I know you all can do 3 minutes of walking, so you can do that program.